In this video, I'm going to share with you my 7 top steps to use your blood pressure monitor at home properly to get correct readings. As the inventor of the digital home blood pressure monitor in 1977, here at A&D Medical, we definitely know how to get the most accurate readings. So let's begin with step number 1. Before you use your blood pressure monitor, I want you to remember the 30-minute rule. So this means avoid eating, smoking, caffeine, and exercise for 30 minutes before you take your blood pressure. And if you're thinking to yourself, well, why should I do that? Well, all of these can actually temporarily increase your blood pressure. So it's not going to give us an accurate representation of your blood pressure. And by the way, don't worry about the readings. We're going to go through what the readings mean, what the target blood pressure reading is at the end of this video. So make sure you watch all of the video. So step number 2, relaxation is key to measuring your blood pressure. So sit down on a good chair with good back support and have your arms supported. You can see basically there's a nice table in front of me where my arms are supported, my feet are flat on the floor, and my back is nicely supported on the chair. I've also already taken a bathroom break, but remember, if you need to go to the bathroom, please go before taking your blood pressure, because again, this can increase your blood pressure. Now, one thing I also want to mention is for more consistent and accurate readings, most of our A&D Medical blood pressure monitors, including the one that I'm using in this video, our precision check device, they come equipped with advanced cuff fit detection and movement detection, which basically ensures that you get reliable results. If the blood pressure monitor notices any of these, you'll see the symbols pop on the screen, which basically means that your results might not be accurate because of it. And this is a really useful feature on many of our A&D Medical devices. Step number 3, it's all about positioning your cuff correctly. If your blood pressure cuff is not positioned correctly, it's going to struggle to detect vibrations and measure your blood pressure accurately. So as you can see in the video, extend your arm out with your palm facing up and position the cuff so the bottom of the cuff is about 2 fingers above your elbow. Notice I'm bending my elbow so you can see that 2-finger position. And in terms of tightness, it's got to be a relatively snug fit, but you don't want it to be too tight. So notice in the video, I can just about fit 2 fingers under the cuff. If you can fit more than that, it's not tight enough. And if you can't fit 2 fingers in there, it's too tight. Now, one of the most common mistakes that I see patients making when they're taking their blood pressure is their cuff size. Sometimes the cuff is too small and sometimes it's too big for them. If your cuff is too small, it's going to overestimate your blood pressure. And if it's too big, it's going to underestimate your blood pressure. Now, thankfully, many of our A&D Medical blood pressure monitors come with advanced cuff detection, which we've already spoke about. So if your cuff isn't fitting correctly, it's going to come up with a sign on the screen to tell you this. But also another thing to note, the device in my hand, for example, the A&D Medical precision check device, it comes with a wide range cuff. Most of our A&D Medical blood pressure monitors come with the wide range cuff, and this allows basically a wider range of arm sizes. We do go through how to measure your arm circumference and cuff sizing in a lot more detail on another video. If you want more information on that, please do watch the video after this one. Step number 4, alignment of your cuff. This is also a common mistake I see many patients making who sometimes wear their blood pressure cuff the wrong way around, upside down basically. So all of our A&D Medical blood pressure monitor cuffs basically come with this little dot. All right, this dot needs to be in line with your middle finger. You can see it in the video as well. I'm demonstrating it, but make sure this dot is always pointing down. Some patients I see, sometimes they wear their blood pressure cuffs this way around, which is actually really hard to wear this way around, but it's a common mistake I see. So make sure it's aligned correctly so that it can measure your blood pressure correctly. And also, whilst we're on the topic of alignment, a top tip of mine, always make sure you let the tube run down your arm like so. I've seen it so many times where patients have the tube running underneath their elbow, and that basically just crushes the tube, so it's not going to help with accurate readings. So always just run the tube down your arm and through your fingers and then connect it to your blood pressure monitor. Moving on to step number 5, we are nearly ready to take our blood pressure. Don't forget everything we spoke about so far. So remember the 30-minute rule, sit comfortably with your arms supported, feet flat on the floor, back supported, and take a bathroom break if you need to go. In addition to all this, make sure the cuff is aligned with your heart. And when you click start, no moving, no chewing, no talking, and please don't block the tube like we spoke about already. And that's it. You're now ready to click the start button and have your blood pressure taken. Remember, if someone else is taking your blood pressure, sometimes people, patients, healthcare providers, they feel a bit awkward and they talk to the patient or the patient talks to them. This will increase your blood pressure. We actually do an experiment on the channel, what happens when you speak and take your blood pressure. The results are actually fascinating, so I'd highly recommend watching it. but try not to talk and tell them that I can't talk whilst it's happening. They'll know exactly what you're talking about when you tell them. But if that ever happens, just one thing to remember. Moving straight on to step number 6, consistency is key. Thankfully, our A&D Medical blood pressure monitors come with a large screen, so the numbers are really clear and visible for everyone to read. And you can see this very easily on screen. You can see the numbers, my blood pressure readings there. We also do have a voice-guided A&D Medical blood pressure monitor as well, and this provides audible readings, so that's just something to note. Now, a very common question I get asked by patients is, how many readings should I take when I take my blood pressure? Ideally, you should take 3 readings. Each reading should be 1 minute apart, and then you average those readings, and that's your blood pressure at that moment. Now, some of our A&D Medical blood pressure monitors, including the device I'm using in this video, so the Precision Check device, they have our trademarked Tri-Check technology, which makes taking your blood pressure an absolute breeze. You can basically switch on the Tri-Check mode on the device, and it's able to take 3 consecutive readings. You can change the intervals between each reading from 30 to 60 to 120 seconds. So you can pick whichever one works for you. I prefer 1 minute apart. So to switch this mode on, you click the clock button until you see the Tri-Check symbol. The default is off, so then you use the arrow key to switch it on. Click the clock button again to set this. It will then ask you to choose the interval for each reading. You can click the arrow buttons to pick between 30, 60, or 120 seconds. Click the clock button again, and you're all set. So next time you do your blood pressure, it's gonna do Tri-Check mode. So it takes 3 readings with whatever interval you set. And best of all, it will then average it and save that reading. Moving on to step number 7, a very common question I always get asked is, what should my blood pressure be? So I'm gonna make this very simple. Unless you're told otherwise by your medical provider, aim to have an average home blood pressure of below 130/80 millimeters of mercury. So anything below that, great. If you're seeing your blood pressure creep above that, speak to your medical provider and let them know. Elevated blood pressure can increase your risk of cardiovascular issues, kidney problems, and stroke. I'd also recommend anyone who's watching this video today to download our free A&D Heart Track app. It's available on Apple Store and Google Play, and it's been designed by doctors to help you manage and keep an eye on your blood pressure and other readings too. One of the things that I really like about the app is you're also able to follow trends. And if you have one of our A&D Medical devices that are Bluetooth enabled, for example, the Precision Check device in my hand, this is Bluetooth enabled. It will be able to pair with the app and automatically send your result onto it, so you don't need to manually input anything. And if you don't have a Bluetooth enabled device, just add it in manually. It's great to keep the information there, to see those trends, to share it with your medical professional. It's really useful. So next up is my pro tip when you are purchasing your blood pressure monitor. Make sure your blood pressure monitor is clinically validated for accuracy, and on the validated device listing, it's called VDL for short, and this is checked by the American Medical Association, Hypertension Canada, as well as the British or Irish Society of Hypertension. Because believe me, a lot of the blood pressure monitors that are available on Amazon are not validated. They're not on the VDL list, so they're not accurate. I've personally been using A&D Medical blood pressure monitors in my very own practice for years because 1, they're an absolute workhorse, and 2, they're on the validated device list, so they've had formal studies done to get them on the VDL list. So basically, the results are accurate. To learn more about A&D Medical and our wide range of health devices, please do check out the description below. We are committed to helping you stay healthy with reliable products. All our blood pressure monitors come with a 5-year warranty if you're in the US, Canada, or UK. Thank you so much for watching, and please do check out our channel for other videos on cuff size demonstrations, measuring your arm, doing experiments to show what happens to your blood pressure when you don't do things right, and loads more. And remember, A&D Medical, discover precision.